What do you know about Georgia's Kinship Care program? Kinship care is a caregiving arrangement that allows grandparents, relatives or other kinship caregivers to provide safe and happy homes to children who need them. Who are kinship caregivers? Kinship caregivers can be grandparents, aunts or uncles, siblings, or anyone who has a kin-like bond with the child. Kinship caregivers may serve as short or long-term caregivers for relative children. Many kinship care arrangements are informal, private arrangements between parents and relative caregivers, while some may involve the child welfare system. Kinship caregivers often assume caregiver responsibilities of their minor relatives because of a family crisis, such as the sudden loss of a parent or the presence of issues that hinder safe parenting. How many kinship caregivers do we have in Georgia? According to www.grandfamilies.org, as of 2019, there were 288,297 children under age 18 in Georgia who were living in a home where other household members were a grandparent or other relative. 76% of them were living in the home with their grandparents and the remaining 24% were with other relatives. Also, over 115,000 of grandparents in Georgia are responsible for the grandchildren that live with them, and 65% of those grandparents are over age 60. The Division of Family and Children Services Kinship Navigator program covers the entire state of Georgia and provides responsive, strength-based support to kinship caregivers. What are Kinship Navigators? The Kinship Navigator program connects kinship caregivers to critical resources they can access to support kids in their care. Depending on availability and demand, navigators help provide food, clothing, and other essentials to those in need. Navigators also help caregivers access services for mental, physical or behavioral health care, legal aid, and other measures to support healthy, happy families across Georgia. Kinship Navigators provide information that help caregivers determine which local, state and federal benefits they may be eligible for. Navigators also work to ensure that caregivers apply by providing assistance with program applications for Supplemental Nutrition Assistance Program benefits, Medicaid, childcare, and parent services, and more. We have 9 Kinship Navigators, 5 Kinship Coordinators, a Kinship Program Manager who provides oversight of service delivery, and lastly, the Kinship Program Director who oversees the entire operation to ensure quality program execution. Advocating for kinship policies and practice changes throughout the state of Georgia. Our mission is to help kinship caregivers understand and access program resources, develop critical systems of support, and provide safe and supportive environments for children in care. For more information about the Division of Family and Children Services Kinship Program, please visit dhs.georgia.gov Kinship Care Portal.